All right, let's quickly talk about complementary healthcare approaches in Australia. These are non-traditional approaches that are meant to be used alongside conventional medicine and healthcare to enhance patient outcomes, all right? They are not to be used as a replacement for healthcare. They are increasing in popularity in Australia due to our increasing multicultural society. Private health insurance support is also being recognised so people can get money back for services that they use from the complementary healthcare approaches. And also the recognition at the university level to include bachelor type degrees for these approaches gives a lot of credibility and weight to how effective these approaches can be when used alongside traditional medicine. Quick recap of some samples here. We've got acupuncture, chiropractic, osteopathy, naturopathy, Chinese herbal medicine, and then finally the advent of digital health products, such as the Calm or Headspace apps, which help to reduce anxiety for people that are experiencing that. So using these approaches as a preventative, they encourage active aging and lifestyle modification to decrease rates of illness and disease in the population. For example, someone who is highly stressed and worked up a lot of the time, maybe a little bit overweight too, starts using the Calm app and seeks a naturopath to hopefully reduce their stress and inflammation within their body, which therefore directly decreases their risk of having a heart attack. What about using these approaches to treat patients' issues, okay? So therapies can treat symptoms, which leads to a positive outlook and therefore further reduces infirmary or ongoing disease and pain. There is something to be said about the placebo effect. The body is amazing at healing itself, and if it thinks that you're getting better, well, guess what? You get better, and it's been well documented over many, many years. For example, a person sees a chiropractor because they've got lower back pain. The chiropractic manipulation takes away the lower back pain, which then supports that person resuming exercise or doing some exercises to strengthen up the core and supporting muscles, which is actually the thing that's going to reduce ongoing lower back pain. And then finally, the real reason why we should be engaging in complementary therapies as a supplement to other treatments, okay? It is highly effective when used alongside traditional medicine, as opposed to just using traditional medicine by itself. You should always consult your GP for support in the treatments that you are seeking to get, and also to check whether there's any negative interactions. For example, St. John's wort actually clears chemotherapy drugs out of the bloodstream. So if you were taking that for anxiety and having chemo at the same time, your chemotherapy may not actually be very effective. A positive example though, a patient uses Chinese medicine and acupuncture for support during chemotherapy. Actually doing something such as acupuncture and Chinese medicine makes the patient feel like they're doing something positive towards improving their levels of health, puts them in a positive mindset, and therefore their body hopefully heals better than someone who was just using chemotherapy alone. And that was your too long didn't study version of complementary healthcare.